So tell me about your Bredesen training.
So yeah, and so after being trained by both you and Dr. Trimp, then Dr. Bredesen's training program came out probably about 3 years ago.
Right.
And to date, he's trained about a little over 1,000 doctors. And he's very well known. He's a neurologist at UCLA and the director of the Buck Institute. And he wrote the second book, The End of Alzheimer's. And basically elucidated 6 different main causes, underlying causes for Alzheimer's. And even though he is a classically trained neurologist, he and did a lot of lab work. He found during all of these studies and so forth, with the influence of his wife and other doctors in the functional medicine arena around him, he determined that truly there is no one cause of Alzheimer's, and it certainly is not amyloid.
Right.
So he opened up even more credibility, shall we say, in the realm of multiple reasons for Alzheimer's. And I can go through the different types. So type 1 is inflammatory. And inflammatory could, of course, come from a whole multitude of reasons. So taking a biomarker or blood test, we can look at various measures that aren't traditionally obtained, markers such as homocysteine, C-reactive protein, fibrinogen levels, uric acid levels, sedimentation rate.
Things that aren't commonly measured at your local doctor's office.
Right. So those are, so those can be measured by a traditional doctor, but that would not be on your normal panel of tests. So that will, give you an idea, those markers and others will give you an idea of your total body inflammation. Right. And of course, as everyone knows, inflammation is a big driver of disease in everyone. So that's something that's understood by.
And in my opinion, it's pretty simple. Most people that I work with, the biggest driver for inflammation in their body is just poor nutrient density of the foods they take in. So their repair and recovery mechanism is being beaten by deterioration, wear and tear.
Absolutely.
And that's the easiest thing to do, and it's often overlooked.
Yeah, absolutely.
That's why Alzheimer's now is called, by Brown University from 10, 12 years ago, type 3 diabetes.
Yes.
And
exactly.
insulin resistance, which is what really diabetes is a major driver of this condition. It's probably the first place that people should look.
Yeah. So with the inflammation, again, that's driven by the foods that we eat and drink, and just toxin-laden environment, which is driving inflammation in the body. Also, gut inflammation with overgrowth of bad bacteria,
right,
will also drive inflammation. So a whole host of things. So that's type 1. Type 1.5 is called glycotoxic, and that kind of goes to what you were saying, the type 3 diabetes of the brain,
right,
where the brain has become insulin resistant as well. So just like in the rest of the body, where we measure fasting blood glucose and it starts to climb as the body is not able to, one, produce enough insulin, or the cells just aren't listening when the insulin is being produced and the glucose is not being pushed into the cells, so it cannot be utilized appropriately. The same thing happens to the brain, and the brain really likes glucose as an energy source. So once that occurs there and the brain can't utilize the glucose efficiently, then that will also result in cognitive decline.
And what people recognize is that the brain uses a tremendous amount of the oxygenated blood leaving the heart.
Absolutely.
25% and it's only a small part of the body, so it's actually 10 times more metabolic. So inflammatory things in your bloodstream create more inflammation in your brain because there's just much more of it up there. There's much
Yes,
more circulating.
absolutely. So that was type 1.5, so having to do with blood sugar. Type 2 is a decrease in hormones, and a whole host of hormones.
Mm-hmm.
So in men, it would be low testosterone levels, which is men listening to this. A lot of men are experiencing this, even in their 30s and 40s.
Sure.
I even have patients that are in their 20s that actually have low testosterone levels for various reasons. So that, is a driver for decreased mental acuity in women. Estradiol, which is the good estrogen hormone, so to speak, in women, and that being low will affect mental acuity. Low thyroid levels will also affect.
Getting back to the hormones you just mentioned, of course, is a very evil substance that our liver produces that is the precursor to all those hormones. And that substance, of course, is cholesterol.
Yes, absolutely.
So anybody on a cholesterol-lowering medication could be at risk for having low hormone levels.
And that's true. So I must say I'm not a big fan of statin drugs because the body makes its own cholesterol, and cholesterol is around for a reason. It is the building blocks of all of our cells. It's the building blocks for our hormones. Greater than 50% of our brain is made up of fat, and that's cholesterol based, right? So when it is abnormally decreased, then problems can ensue. So, but yes, in general, the body has a higher level of cholesterol for a reason. So yes, low hormone levels could be a reason why your cholesterol levels are up. Increase in bacterial load. Yes, so there are a lot of reasons there. But yeah, getting back to the other things. So yeah, so hormonal deficiencies, cortisol being low, that also drives this process. So as a functional medicine doctor, looking at all of those parameters in that realm can provide a window into what is going on. So type 3 is called toxic. And the toxicities can arise from a multitude of things. Mm-hmm. And also toxic type 3 is one of the main causes of Alzheimer's in our younger population, where we have 40-year-olds getting Alzheimer's.
I see.
And
okay.
Yes, and that's generally due to, it could be due to mold. And what mold causes is mycotoxins. And these are the toxins that are liberated that about 25% of the population is actually very sensitive to from a genetic level. You can actually do genetic testing to determine this. But it's not really always necessary to do that because there are a whole host of other tests that we can do to see that your body is reacting to mold. And we can also see if your body is excreting mold in urine and so forth. So we can do those tests, but that's a big cause that's not well known. And a person can live in a moldy house and really not know it because mold is often not seen. Sometimes it can be, of course, the black mold is, the preeminent one, but there are a whole host of other molds that are problematic. And again, if you are a susceptible individual, then that needs to be elucidated. So that's a big cause. Another big cause is
a lady you and I worked on didn't have Alzheimer's. She was only in her 30s, but she had a very rare autoimmune disease called polychondritis.
Yes. Mm-hmm.
When we titrated back, we found out that she spent 9 months doing painting. She was a painter in a basement that was very moldy.
Right.
I think she became sensitized. And then in the spring, when the snow would recede, she was in Indiana, the molds coming out of the snow would reactivate this thing. And so
Absolutely.
we couldn't treat the mold per se, or we did somewhat, but what happened is she got some downstream infection because the mold made her whole body vulnerable to other things. We actually improved her polychondritis symptoms, which is a very rare, like I said, a very rare autoimmune disease. So
Absolutely.
mold is
Yeah.
insidious. It's like mold just doesn't correspond with Alzheimer's. It corresponds with immune dysfunction and vulnerability to any number or broad spectrum of diseases.
Absolutely. Absolutely. So very important to determine that and put the patient, well, obviously eliminate the source. That's the
Right.
first thing. So, and then put the patient on appropriate supplements to bind and help accelerate the process of the body being able to eliminate those things. And it is a process, and it's not an overnight one. But again, this is something that is very, very overlooked. So another cause of toxic would be heavy metals.
Sure.
So high mercury, high lead, very, very common. And whole sundry of other metals, cadmium, cesium, and all of those. But mercury being high on the list for various reasons. One that is very common is dental amalgams. So silver fillings, gold fillings, where 50% of that substance that is put in the cavity is actually made up of mercury.
Mm-hmm.
And it actually vaporizes over time from chewing, drinking hot liquids, and so forth. And it's a slow process, but it just, those minuscule particles get into the brain and ultimately cause destruction. And there are other things, of course, there, other pesticides and whole things, but
Sure.
people kind of understand from a toxic environment that can significantly impair mental acuity. And then type 4 is vascular. So then if you have clogged arteries, and again, cholesterol is not the enemy.
Mm-hmm.
Cholesterol can be found at the scene, however, because it is really ultimately sent there to repair the damage to the blood vessels that the inflammation has caused.
Mm-hmm.
Because on the inside of our blood vessels is supposed to be smooth and slick, like a Teflon surface. Nothing is supposed to stick to it. But if in an inflammatory condition, it gets rough on the inside. And then that roughness, then debris and cholesterol is drawn there to kind of smooth that out. And of course, other things can accelerate that process. Even infections can be found there.
Mm-hmm.
And other things that are drawn there is calcium, which is really ultimately the main culprit.
Right.
Which is, I like to test my patients to have them have a calcium heart score, which is basically a CT scan that shows how much buildup of calcium is in the arteries of the cardiovascular system. And even some traditional doctors are kind of getting with the program with that and starting to recommend that. And that's something that's covered by insurance.
I think it's important to understand why this vascular component is really important, because a lot of people, especially if you go to a neurologist, don't view Alzheimer's as a vascular condition.
Absolutely.
And look at the continuum from a heart attack, big vessel, stroke, smaller vessel, but big vessel in the brain, microinfarcts. Most people that go and already have some level of dementia, when they run an MRI on them, the doctor will say, hey, you've already had some small strokes. I didn't even know you had. Then there's vascular dementia. And then on the far end of the spectrum is Alzheimer's, which suddenly drops off from the vascular continuum.
Yes.
But the trouble is MRI technology to map and create 3D images of the brain doesn't have the resolution to look at the capillary level.
Right.
And, it's hard to prove it, but in glaucoma, we can use a tomography technique similar to MRI which shows capillaries, and we can clearly show damage to capillaries, thus loss of blood flow.
Absolutely.
And you need to have a capillary within 3 cell diameters of any living cell. As capillaries start losing their integrity, you start losing neurons, not in mass like in a stroke, but sort of like the internet.
Yes.
And that's the problem. So anybody who doesn't think these neurodegenerative conditions are not vascularly driven has to go up a significant learning curve, because it's just true.
Right, absolutely. And with that, we also do what's called a carotid intimal thickness test, and that's a test of the carotid arteries, and
Sure.
that will also compromise blood flow directly to the brain, because the carotid arteries are in your neck, going
Right.
directly to the brain. And then, like you were saying, with the smaller blood vessels and eventually in the capillaries, if there is a decrease in blood flow, that can be elucidated by these various imaging techniques. And one is called a SPECT scan, which actually shows blood flow.
Mm-hmm.
And that's a very popular one in the neurodegenerative category. But of course, it's not widely done in traditional medicine. But that's a great scan to do to show decrease in blood flow. And even one of the simple tests would be the RDW, which is the red blood cell distribution width.
Right.
And if that number is up, then that means those blood vessels have to squeeze down and flatten out, thus the width, so they become longer. And so
blood cells, right? The blood cells have to squeeze. Yep.
Yeah. So then that tells you that those vessels are compromised by something. Is it inflammation? Is it calcium buildup? What have you? So a whole host.
It doesn't matter at this point. We just know we have inflamed vessels.
Right.
Yeah.
And a compounding factor, something that also is not very well elucidated, is history of sleep apnea. So if you combine a low blood vessel diameter and low blood flow, coupled with someone having apneic episodes at night, and their blood oxygen saturation is decreasing, then you have a recipe for disaster. And then number 5 is traumatic brain injury.
Sure.
And that's very common in a lot of people. Some people don't necessarily think about it, but if you, as a child, if you fell out of a tree, knocked your head, fell off a skateboard, those minor concussions, all the way up to severe concussions, still count as some type of brain engagement at some level. And everyone has different susceptibilities. I mean, we think, football players.
I've had 5 concussions.
Yeah, so
and
that explains it.
If you look at, doesn't it though, Michael? But if you look at the NFL players, they have a much higher incidence of Alzheimer's. So it's clearly driving the same mechanism. You have a concussion, it's probably affecting the integrity of the tissue.
Absolutely.
Blood flow in that region. And then triggers an inflammatory response, which can be beneficial, but also can have collateral damage. So in my view, with microglial activation, the difference between Alzheimer's and a concussion is just the rate at which the deficit in blood flow is occurring in that tissue.
Yes.
To some degree, naively, that's not the entire story, but there's certainly an overlap in the two, and that's why one exacerbates the other.
Absolutely. Yes. So that kind of, and with that still touches the surface. There are a whole lot of other things to really go into more detail about, in how the brain can be affected by a whole host of things. But that gives people an idea of, it's not just one thing.